Hi, everybody. I'm Judy Haber, and I am a nurse practitioner. So this panel will present a slightly different perspective. As Ron said, I'm on the faculty at NYU College of Nursing, and I am a product of the innovative partnership of nursing and dentistry at NYU when Mike was the dean and Terry Fulmer was the dean of the College of Nursing. And as a result, I'm fortunate enough to lead a national nursing oral health initiative called ONEP, Oral Health Nursing Education and Practice, funded by DentaQuest and the Arcora Foundations, and originally actually also funded by HRSA. So that has been a wonderful partnership. And I'm also honored to be a senior scholar with the Santa Fe group, and that has been a wonderful privilege, and probably the reason that this panel is here today, because I got to put my 2 cents in as a member of the planning committee. But I want to start by saying that George Isham and Stanley Bergman's comments provide a perfect segue for our panel, which is about whole person care of older adults, but through an interprofessional lens. And what we hope to do is to switch the message a little bit, make it more integrated so that it reflects whole person care a la medical dental integration or the oral systemic connection, however you wish to phrase it. Because as interprofessional education and practice expands, and it really is expanding, oral health provides numerous opportunity for recognizing oral health and its links to overall health. It is really a key, thank you, George, population health issue, although not thought of that way very often. But the interface between oral health and overall health really does impact whole person care, especially for older adults who, as we've heard, have 1 or more chronic conditions, take an average of at least 4 medications, and have multiple comorbidities, as was mentioned earlier today. So that to provide whole person care in the true sense of it, we do need to think about the collaboration of dental and non-dental professionals who can really promote the integration of oral health with overall health in primary care, acute care, home, and long-term care settings. And those are settings that show great promise for interprofessional team-based care to advance this agenda. And we, who are not dentists, know and have partnered with many dentists to move the agenda forward of promoting screening and promoting vaccinations, blood pressure checks, and so on, tobacco cessation counseling in dental offices. But we've heard a lot less about oral health being integrated by primary care teams, and it is happening, including oral health assessments, hopefully using the he-not approach. When you use the he-not approach to the HEENT exam, you cannot forget about oral health. And by including that approach in the history, the physical exam, in risk assessments, thinking that way, really, and in providing management of chronic conditions, diabetes, cardiovascular disease. We've heard the list, and I have a long list, actually, but also providing health promotion, nutrition coaching, tobacco cessation, and participating in promoting documentation of oral health findings in the electronic health record, which isn't right now very communication friendly, as we just heard. But we are working hard across the professions at integrating oral health into the workflow and standards of care, not only in primary care settings, as has been a major emphasis of the conversation in the last number of years, but also in diverse acute and community and long-term care settings. So our interprofessional panel of non-dental oral health champions, and we are all oral health champions, physicians, nurse practitioners, physician assistants, and Anita, who has been, is a social worker, even though she has led PA programs, but I can't fail to mention the social work combination. We are all pioneers in medical dental integration. We lead innovative, I would like to think high impact, national initiatives linking oral health with overall health, and have built interprofessional oral health workforce capacity. And in many cases, we do use the World Health Organization model and have adapted it to building interprofessional oral health workforce capacity across the core professions through clinical education and practice initiatives, having a high impact on improving whole person care of older adults. So our presenters today are Anita Glicken, who is the Executive Director of the National Interprofessional Initiative on Oral Health, or NIIOH, Hugh Silk, who is a professor at UMass Medical School, and he is the co-PI of the SIPCO initiative funded by HRSA that is creating all kinds of data about our building workforce capacity. Tony Miller, who is one of the founding directors of PA education, actually, and leads the program at Shenandoah University, and Rita Jablonski, geriatric nurse practitioner, professor at UAB Birmingham, who is funded by CMS, actually, to lead a demonstration project related to oral health and older adults with dementia. And this is one of many programs she has led. So, Anita, would you be our lead presenter?
I